Welcome everyone, my name is William Woof and I will be presenting our work on improving diagnostic confidence in inherited retinal diseases with conformal prediction. So just to give some background, inherited retinal diseases are a family of disorders which affect the retina at the back of the eye. So these disorders are caused by single gene mutations in any of over 300 different known genes, which can lead to a wide range of different conditions, often resulting in significant vision impairment and even blindness. There's many aspects of care for patients with IRDs, but what I want to focus on in particular is genetic diagnosis. And what this means is identifying a specific gene which is behind the patient's condition. Genetic diagnosis is becoming increasingly important as novel gene therapies start to become available. However, genetic testing is often not as straightforward as it might seem. We have developed a neural network-based classification algorithm called Eye2Gene, which attempts to predict the causative gene from retinal scans, which can be collected inexpensively and non-invasively. The hope is, with this technology, we can accelerate the genetic testing process and improve yields by leveraging AI-assisted phenotyping. So the setting for this work is really about how we convey information to clinicians and other decision-making individuals. Because often just giving the top output of the prediction algorithm is not enough. There's so many different genes to choose from, and some cases they're easier, and some cases are much harder than others. So, as I mentioned, sometimes just giving a single output prediction class can be undesirable, and we may want to give multiple candidates instead. So one area where people may be more familiar with this is in top K predictions. So this is where you take you rank the outputs by probability, and then you just take the top K prediction classes and then give those as an output set. However, an alternative is conformal prediction. And what conformal predictions are is, for every case, you take your predictions and you keep you basically size your prediction set to match a certain confidence level. So with varying size prediction sets, an obvious thing is you can just make a prediction set arbitrarily large and get arbitrarily good performance out of it. So the real thing is, how can we trade off the average size of the prediction sets with the overall accuracy? So the way we describe accuracy in the terms of conformal predictions is something called coverage, and that's basically just as you'd think of average in any other context. It's the number of occasions, number of examples where the correct label was included in the conformal prediction set. And so you have this sort of trade-off where you can either get higher coverage with slightly larger prediction sets, or you might be get smaller sets but then sacrifice some accuracy. So the way we control this trade-off is basically by selecting a confidence threshold, and this is basically our sort of target coverage. And the way we can very simply do a conformal prediction is basically we rank our predictions by likelihood, and then we can keep adding our classes to our conformal prediction set until we reach that threshold. However, a big issue is often our output predictions from our predictor are not well calibrated. So we need to be able to fix that, and the way we do that is via calibration. Now, there's multiple different ways we can do calibration for conformal prediction sets. We've had a look at 3 different ones here in the paper. I'm not going to go into too much detail. These are least ambiguous prediction sets, adaptive prediction sets, and then regularized adaptive prediction sets. And so all these have advantages and disadvantages, and we thought we'd just compare them to see how well they did on our data set. So looking at these results, we can sort of see that the different approaches roughly conform to actual confidence level versus the empirical coverage. That's where we set the threshold versus what we actually got. In all these graphs, we'd expect that to be basically a diagonal line. And we see actually they can sort of deviate from that in different ways. But I think one particularly important thing actually here is we see at our different confidence levels, we see our empirical coverage is often much higher, particularly for the APS approach. Interestingly, when we looked at this by individual gene, we found that genes that often were confused regularly with other genes often tended to tend towards larger prediction set, while genes which didn't really have any similar genes in our dataset ended up resulting in much more confident, smaller prediction sets. But what we're ultimately interested in is how well do the different trade-offs between empirical coverage and average set size compare across the different techniques. So on our dataset, we immediately see that APS seems to do worst of all. However, the regularized version of APS seems to do a little bit better. And best of all seems to be the LAPS. However, just at this top end here, we do see sort of crossover between LAPS and RAPS, which suggests that at the most certain confidence thresholds, there may be a trade-off between the different techniques there. So in conclusion, conformal predictions seem like a great option that you should definitely consider if you have a case where you can potentially give multiple options to the end user. However, as we've seen, the methods can vary quite a lot, so do have a look at comparing how different methods compare, and also be careful to choose your thresholds appropriately, as we saw that often even after calibration, the empirical coverage often didn't match the threshold. And finally, the question is obviously we've seen this, it seems like a good technique, but as with everything, what would be really interesting to see is actually how well does this affect things in practice? How well does giving conformal prediction over a point prediction help our decision maker? So thank you for watching, and goodbye.